Time to say a very warm, weekly hello to Mr. Peter Hitchens. Peter, very good morning to you.
Good morning to you too, Mike.
Well, I mean, it's perhaps even more ridiculous this week than it was last week, isn't it?
Very ridiculous indeed. And I was just doing something I used to do all the time, but have become a bit lax about lately, which is checking the coronavirus worldometer, which actually gives the figures for deaths from COVID-19 on a daily basis. So it's not wholly reliable because there's some catch-up involved. Because I thought, well, what are we fussing about with Spain here? And if you look at the total coronavirus cases in Spain, they are rising, though not to anything like the levels they were at between March and late April. But if you look at the daily new deaths in Spain, they pretty much cease around about June the 13th. There are very small numbers. June 17th, daily deaths 6. June 22nd, daily deaths 1. June 25th, 3. Then skip to July. July the 4th, 0. July the 9th, 5. July the 19th, 0. July the 23rd, 3. July the 25th, 0. This is not, it seems to me, a reason to destroy the holiday hopes of, I think, probably something in the region of 1.5 million people.
Right.
The whole obsession with the infections is very strange. I mean, in many cases, these infections, we never hear whether the people involved are actually ill or not.
Right.
And if you ask the question, are they ill or not, no answer comes back. And I think in most cases, the truth is they're not. What's happening is the governments everywhere are searching under this strange obsession they have with testing. They're searching for infections, and they're finding them. But
well, I mean, it's certainly
they're not ill, and so why? As again, this is completely out of proportion to the actual menace.
Well, this is the thing. I mean, in Barcelona, we're told that the rise in infections is entirely down to nightclubs being open and a lot of young people getting infected. Now, there's a pretty good chance that most of those young people will not be in any harm's way whatsoever, but they have created a spike, and so therefore Barcelona has shut down all the nightclubs again. And it seems to me that that's the wrong course of action, because surely what you want to do is just get used to it and say, right.
The character of all these actions, I mean, I call it the Canute policy, because people of my generation all know the story of King Canute. But I think increasingly people now don't know the story of the king who to explain to his courtiers that governments simply don't have that much power, arranged a bit of street theatre on the Sussex shore, and set up his throne and ordered the tide to cease coming in.
Right.
And it ignored him, and he got his feet wet. And the whole point of the story is governments just aren't that powerful. Right. The idea that governments can control the spread of a submicroscopic virus has always seemed to me to be pretty, how shall I put it, pretty overstated.
Right.
And that's one of the whole problems with this. It's a ridiculous utopian belief that by going around telling people to stay at home and spraying everyone with gallons of hand sanitizer and putting muzzles on their faces, we can stop the spread of a disease which has spread naturally among us anyway. And it was long ago, it seems to me, quite out of control as far as spread is concerned. And they seem to enjoy the power which this has given them over us, to order us about. Don't go there, don't do that, wear this, walk along this line, stay at this distance from everybody else, don't go to work, stay off the trains, whatever it may be, don't go on holiday, don't go on the beach. An endless series of barked announcements say don't do this, which, as far as I can see, have absolutely no effect whatsoever on the number of people who've died from the disease, which is largely stoked by what appears to have been a major piece of incompetence over care homes earlier on in the
Well, they also now say that they think,
and didn't.
But they also now say they think a lot fewer people died of COVID than they said they did in the first place. But also, if you go back to the beginning, I seem to remember at least 3 to 4 members of the cabinet saying at those briefings, you know, in the end, everybody will get this virus. And I mean, I haven't seen them retract that yet.
Well, it did, and maybe so. The whole theory of herd immunity and all the rest of it, people have varying views about what level of a population has to have it before it takes place. But if this is what happens when the government continues to imagine, in my view falsely, that it can control the spread of the disease, then I think we are again compelled to look at Sweden, where they have allowed the disease to spread among the population and create normal immunity, where they're pretty much through it. Where although they also messed up their care homes and therefore have a far higher level of deaths than they should have done. That wasn't caused by their decision not to go for tight controls. It was caused by messing up the policy on the care homes. And in general, Sweden has come out of this considerably better off than we have, and I think that it is the example everybody else should now be looking to. And I would have thought, as a rational person, the people seeing the government flailing around, suddenly banning them from going on long-planned and much hoped-for holidays, that they're in the hands of people who simply don't know what they're doing, which has been the case from the start.
Well, I suppose it's not quite correct to say they're banning them from going anywhere. They're just saying if you do go, and if you are there, you'll have to do a quarantine when you come back. But the quarantine itself...
That means people having to face quite possibly
but it's not a ban.
Paid for
no, I know. No, listen, I'm not disagreeing with you, but the thing I find extraordinary as well is that when the original quarantine was imposed, the one that they dropped a little while ago so people could go on holiday, there were so many exemptions to it that there was literally 2 pages worth of exemptions, including BBC engineers, including pilots of airlines, including people that work for Eurostar, and including migrant workers.
Yes, well, quite. I didn't realise BBC engineers were...
Yes, yeah. I was going to ask you about the BBC.
If by any chance key workers such as myself were exempt, but no, I wasn't.
Well, I was going to ask you about that because I listened to Any Questions. I was pleased to see that finally, after listening to obviously the greatest show in the world here with you and I interacting, that the BBC have finally worked out might be quite a good idea to put you on Any Questions.
I think I must owe a lot of that to you. I think well, honestly, I had thought that the BBC had pretty much cut me off. And wouldn't let me speak on the subject at all. And they let me on once on the Today programme to talk about something else for about 35 seconds. Right. But Any Questions, which is I've actually been appearing on unbelievably to me now for a quarter of a century now. It has always been a favourite programme of mine, but my appearances on it have been growing less and less frequent over time. And I had been worried, and I was really quite pleased when I got an invitation. It wasn't, of course, the normal programme, because they don't do that.
No, it's all done remotely, isn't it?
And the BBC headquarters is totally deserted.
Yes, I mean, that's even more bizarre, isn't it? But let's get back to the nanny state, because the quarantine for me is only a quarantine. My daughter's colleague, who was working in Dubai, had to go back to Australia and was put into quarantine. They drove him basically in a government car to a hotel, put him in a room and said, you stay there for 14 days, you don't come out. That's quarantine. What we're offering is a sort of a laissez-faire quarantine. If you feel like it, please try and stay in unless you absolutely have to go out.
Well, there used to be in our trade an expression called going through the motions, of pretending to do something while not actually doing it, which was sometimes the wisest response to the commands of mad executives.
Yes.
And then by the time that it turned out you hadn't done it, they'd forgotten. Right. There's an awful lot of going through the motions in the government's actions here. They're pretending to be active without actually really doing it. Right. Because they know perfectly well that if they did the things which they claim to be doing seriously, they would actually stop the country dead. I mean, not just jam the brakes on so it can barely move as it is now, but it would actually stop. There wouldn't be any economy. There wouldn't be anything happening at all if they did the things they claim to be doing properly. Genuine quarantine. But the whole point about quarantine is it was always, in the whole history of mankind until now, it was always used to quarantine people who were actually sick and infectious. Right. It's never previously been used to quarantine the healthy, who of course are always going to be the great majority, and far more of them, and it's extraordinarily difficult to do.
Yeah, and also the logic they seem to be
a Stalinist state to do it effectively, which also the logic have not yet got.
The logic that they're attempting to use as well is kind of twisted, because I was just talking to a doctor before you came on who, much to your chagrin, I'm sure, said that he was hoping for the normalisation of mask wearing. I said, I've got somebody coming up who's not going to agree with that. But basically, they want to say to you, look, there's no point in us testing you and then keeping you or making you available for work if you test negative, because it doesn't mean that you're negative. In which case, they might as well say everybody could have it, and then therefore everybody should be quarantined and never go out.
Well, this is the thing which has made me reconsider immigration. I had thought that I was too old to do it. But looking at this, I think the normalisation of muzzle wearing is something which quite a lot of people would like to see. And just think about the implications of that. The human face is such a vital part of communications and life. And the idea is being spread that actually, for the rest of our lives, we'll be going about in public with half our faces covered. There is something so profoundly unnatural about that to me that it gives me the creeps.
Yeah.
And also I find the sight of people walking about those so distressing. They look so strangled and pathetic.
Right, and there's more of them now.
And submissive.
Yeah.
And I feel I'm surrounded. But the thing I've been racking my brains as I argue with people about this. What is it that is so frightful about it, and why do I object to it so much? And it came to me that this is actually compelled speech. If you wear one of these things, you are making an expression of support for the government's whole policy. You're saying I am actually supporting the government's Canute-like policy of trying to control the spread of a virus by extremely oppressive measures on personal life. And it's like being compelled under the threat of a fine to wear a great big badge saying, I support the government and its policy.
Yeah. Well, I would differ from you slightly there. I mean, I would say that would be the case perhaps if you were wearing one all the time. I mean, I take a slightly more relaxed view, which is that if I'm on public transport and they want me to wear a mask, I'll wear one. I don't go on it that often. It doesn't really affect me too much. If I now have to wear one to go into a shop, I'll do it because that's what they want me to do. But I certainly don't agree with the government's policy on everything. And certainly I do not wish to advertise that. And I think in a way, you're juxtaposing somebody's willingness to go along with a sort of a herd immunity type view, I suppose, if you want, and you're making them out to be sort of fanatics.
No. Here it is. It's the compulsion. Anybody who wants to wear one of these things, I'm not going to go up to them and berate them for it. I'm not going to try and stop them from doing it. If people actually want to go around for the rest of their lives with half of their faces covered by a piece of soggy cloth, that's for them to do. I can't. But what is the concern here is it's the compulsion.
Yeah.
You say, but it's not being asked all the time. But every few days, the places where this is being mandated spread. For instance, a lot of people didn't notice when the muzzle edict was extended to shops. The rules about transport were also extended. Previously, they'd said you had to wear them when you were on a train, bus, or plane, or boarding them. Right. Now it extends to all railway stations, airports, and bus stations.
What? So you have to wear one on the platform?
You have to wear one on the platform. Right. Technically, that is now the law. And remember also, these laws are not being made by Parliament. Parliament is barely functioning. These laws are effectively decrees.
Yes.
And they're not. There's been no discussion, no chance for anyone to lobby the government and say, look, we're not sure about this. Nothing at all. Right. My problem with the blood transfusion service, where I'm supposed to be giving blood this afternoon, but the English blood transfusion service has suddenly, in between my booking the appointment and my going for it, has suddenly introduced a requirement that I must wear a face covering to give blood. Now, the bizarre thing about this is the Welsh blood service actually insist that you don't wear a face covering because they believe it to be dangerous. Right. They say that they can't see, if your face is covered, they can't see the signs that you might be about to faint, and therefore injure yourself. So they won't let people wear these things during blood transfusions. So if I can't manage to give blood in London today, which I'm hoping to do, then
will you not give blood then? Will you not give blood if they make you wear a mask?
No, I'll go to Wales.
All right. It's a long way to go to give blood.
Well, it is, but the people of Wales need blood.
But you'll have to wear a mask on the train.
Well, there's the difficulty, isn't it? Though again, there are all kinds of subtle things about these rules, which I have found are extremely flexible. I went to a lot of shops yesterday. Yeah. Was not bothered. Did not wear anything on my face.
Did anybody give you a hard time?
Not at all.
Right.
Absolutely. No, I find if you say the right thing to the people who go into the shop, they give you a cheery wave and a smile. Once you've given them a reason to let you go by, and they do that, and that's fine by me. I think that's a very intelligent way of the shop.
Well, it's quite British, though, isn't it?
It's very British, and alas, you do not find it in France, for instance. You try to go to a restaurant, they won't let you in the restaurant unless you cover your face. Yeah. Then, once you've sat down, you can uncover your face. But then, if you want to go to the lavatory, you have to cover your face again.
Right, I know. It's
get
crazy.
Up from the table. It's madness.
But I find that
France has always been a despotism anyway.
I find that it depends on the hostelry. But I've been to a few bars and restaurants in the last couple of weeks, and most of them are pretty relaxed. Very few are actually insisting that you fill out a form. I've only been to one place that's done that. And I went to one other place where the woman who was sort of standing on the door, basically, I said to her, what's the situation? And she basically said, well, I'm so fed up. Basically, do what you like. And I mean, I think a lot of people are now taking that view.
Well, there are a lot of sensible people. I went to church yesterday morning, and they're supposed to take your name. And I said, Ken Dodd, the Broken Biscuit Repair Works, Knotty Ash.
Did they write it
and
down?
Everybody laughed, and that was it.
Yeah.
But someone insisted on squirting me with that horrible hand sanitizer as I went in. Sooner or later, all that stuff is going to run into the sea.
I know.
The sea is going to be sticky with hand sanitizer, stinking of it. There'll be letters to the Times from dolphins and whales saying, can you stop forcing us to absorb all this poisonous alcoholic hand sanitizer?
Yes. Well, here's something else for you, which I imagine you will be as incensed as I was this morning reading the front page of the Daily Telegraph. Lose £5 and save the NHS 100 million quid. Well, I'm sorry, I refuse to do that. You know,
I mean, it's not actually quite that simple a sum. I have actually managed to lose weight from time to time. It gets harder as you get older.
Yeah, it does. Tell me about it.
But I do take exercise, and I've long believed that people who take exercise and remain reasonably fit, and if you can keep your weight down, should be given tax breaks for it. Because I think I don't want to punish anybody for not doing it, but I think people who make the effort should be rewarded. Because frankly, if you do take exercise, you greatly reduce the chance you're going to be burdening the health service, and it's a good thing. But so much of the advice about food that's given is rubbish.
Right.
You can't. It's sugar, salt, and fat. There's nothing wrong with fat. Fat doesn't make you fat. Fat is, in many cases, what gives the food its taste. And the reason why there's so much sugar and salt in food is because the fat's been taken out.
Yeah.
And my favourite item of food, from the satirical point of view, is something called a fat-free blueberry muffin, which you sometimes see. It's such a complete piece of rubbish. The fat-free blueberry muffin is a ball of sugar.
Yeah.
If you eat it, you will become fat. And the fact that it has no fat in it is of no benefit. I had skimmed milk. It's completely pointless misunderstanding of nutrition. And also people think that by taking exercise you'll get thinner. I am living evidence that you do not.
Yes.
I ride a huge number of miles a week on my bicycle at normal time. I've never lost an ounce by doing it. In fact, it probably puts weight on because you feel justified in eating more when you've done it.
Yeah, but also there's nothing worse, is there, than somebody like Boris Johnson who lost some weight because he had a terribly bad health experience and a health scare, but he now wants everybody else to do the same thing. Well, I'm sorry, one, it's not his job to tell me what to eat, and two, it's not my job to save the NHS 100 million. He could save 100 million in the NHS by doing away with Public Health England, which would be a far better method of saving money.
There is much in what you say. I mean, the poor chap. I mean, I don't dislike him personally. It is a shame that he was so ill, and all the rest. And one is glad to see that he's being more sensible.
Totally.
But the trouble is, being Prime Minister is bad for your health.
Yeah.
You can't exercise for a start. The security people won't let you do it, and you're constantly being fed things, and it's a sedentary life, and it's a stressful life. And my advice to him, if he wants to be more healthy, is to resign.
Yeah, that's probably very sound advice.
Anyway, frankly, at the moment, because he's made such a mess of the country, the sooner he does it.
Well, I mean, I'm a bit more of a supporter of his than you are, but that wouldn't be difficult.
Well,
but also, my worry about this is the beginning, and you would have probably said this at some point over the last few weeks, of this kind of creeping, now we must save the NHS from this or save the NHS from that. Let's clap everybody and tell them what a great job they're doing, and now we must do this, that, and the other. I mean, they need to overhaul the NHS. It is so fat in the sense of waste that it's ridiculous. But nobody's willing to do that.
It often doesn't work very well. Every few months there are terrible cases of hospitals where things have gone very badly wrong, particularly with birth defects and things like that. Where you get, and it's impossible, it seems to me, to ask people who've had experiences of that kind to clap the NHS as if it was a completely wonderful service. The French have a pretty good National Health Service, which, amongst other things, abolished mixed wards. In fact, wards as such, about 30 years ago. You don't go into a great big ward in a French hospital. You get a room, and that's normal. But they don't make a fetish out of it. Right. It's something that's accepted that ought to work and more or less does work.
As many people,
ours is not that good.
No, well, as many people have pointed out in the past, if our service is so brilliant, our health service, the way we run it is so brilliant, why does nobody else in the world run it the same way? because in Germany, one of the reasons they did so well with the testing and tracing and all that is because all of the labs are privately run, privately operated, far more efficient than anything that public health England can do.
It goes both ways. I'm not. When I lived in America, I lived next door to a medium-sized private hospital in the suburbs, and I went and took a look at it, and I then went back down to DC and looked at the big public hospital there. The truth is, it's not really a matter of public or private. It's got much more to do with the way in which the thing is managed. But ultimately, all health services are illness services, and the thing which a government should be trying to do is to encourage people, as I said earlier, to avoid becoming ill in the first place. Because once you are that badly ill, there's nothing anybody can really do except submit you to all kinds of unpleasant surgery and drugs, which won't actually make you as healthy as you would have been if you haven't got ill in the first place. It's prevention we need, and that the advanced societies of the world really do need to concentrate on prevention if they want to solve the health problem.
No, I totally agree, Peter. We're at the end once again, but it's a very enjoyable conversation. Thank you very much indeed. Do let us know the outcome of the blood scenario next week, perhaps, when we talk.
Don't worry, you'll be hearing about it.
Very good. Peter Hitchens from the Mail on Sunday there. You may agree with much of what he says, you may disagree with much of what he says, but he does hold his views very firmly and with a great sense of belief, and so you have to give him praise for that.